Can a doctor examine a girl or woman and prove whether she has had sex? The medical answer is no. Virginity myths. What medical science can and cannot prove. Hello and welcome to Fluentoons English. Our purpose is to explain meaningful, educational, and motivational topics through simple and clear English today. We will discuss a sensitive subject with respect, virginity myths, the Hymen, and what medical science can and cannot prove. This video is not made to judge women, insult any culture or religion, or encourage sexual activity. It is made for health education, truth, dignity, and better communication. There is no reliable physical examination that can prove a history of vaginal intercourse. The appearance of the hymen cannot prove whether someone has or has not had sex. Virginity is not a medical diagnosis. It is a personal, social, cultural, or religious idea, and different people understand it differently. So, what is the hymen? The hymen is a small, thin, flexible piece of tissue around or partly covering the opening of the vagina. It is not normally a closed wall or a seal. Menstrual blood needs a way to leave the body, so the hymen usually has an opening. Hymens naturally come in different shapes, sizes, and thicknesses. One person may have more visible tissue, while another person may have very little. Both can be completely normal. The hymen may also change over time, hormones, normal growth, sports, exercise, tampon use, medical procedures, or sexual activity may stretch or change it. In some people, the hymen may remain flexible and show little obvious change even after vaginal intercourse, because everybody is different. Looking at the hymen cannot tell a doctor what someone has done in the past. Now let us discuss a common myth. Myth number 1. Every virgin must bleed the first time she has vaginal sex. This is false. Some women may have light bleeding, while many women do not bleed at all. Both situations can happen. Bleeding may depend on tissue flexibility, natural lubrication, relaxation, friction, or a small injury. No bleeding does not prove earlier sexual activity, and bleeding does not prove virginity. A bed sheet, a blood mark, or the absence of blood cannot provide a truthful medical answer. Myth number 2. An intact hymen proves virginity. This is also false. The hymen does not have one standard appearance. It may naturally be thin, thick, elastic, irregular, or difficult to see. Some people may have very little hymenal tissue from birth. Other people may still have visible hymenal tissue after intercourse. There is no single appearance that means virgin, and no appearance can prove that sexual intercourse happened. Myth number 3. A doctor can perform a virginity test. So-called virginity testing may involve inspecting the hymen or inserting fingers into the vagina. Major health organizations say these practices have no scientific basis. Such examinations cannot prove whether intercourse happened. They may cause fear, shame, humiliation, and psychological trauma. Myth number 4. Sports, cycling, running, or normal exercise can take away someone's virginity. This is false. Physical activity may stretch hymenal tissue, but it does not determine sexual history, character, or values. A person does not become sexually active because she played sports, rode a bicycle, used a tampon, or had a medical procedure. Myth number 5. A woman's character or value can be measured through her body. This idea is harmful. Honesty, faith, kindness, consent, and personal choices cannot be measured by examining one small piece of tissue. A person's dignity does not depend on the appearance of the hymen. Human value is not a medical test result. These myths can cause emotional harm. A girl may become afraid of marriage, medical care, exercise, or even her own body. Families and partners can also suffer when suspicion replaces trust. Myths may lead to unfair accusations and damaged relationships. Healthy relationships need respectful communication. People may have personal, cultural, or religious expectations, and these beliefs can be discussed honestly, but no one should use an unscientific examination to control, shame, threaten, or humiliate another person. Consent, privacy, dignity, and safety should remain central. Medical questions should be discussed privately with a qualified healthcare professional. A hymen examination cannot confirm or rule out sexual assault. Not every survivor has visible injuries. The absence of visible injury never means abuse did not happen. Anyone who has experienced forced sexual contact deserves safety, respectful care, and emotional support. If someone has heavy bleeding, repeated bleeding after sex, severe pain, difficulty with periods, or another concern, she should speak with a qualified doctor. Healthcare should focus on treatment, not judgment. Remember the main facts. The hymen is flexible tissue, not a seal. Hymens naturally look different. Not every woman bleeds during first vaginal intercourse. Bleeding or not bleeding proves nothing about virginity. The appearance of the hymen cannot prove whether intercourse happened. Virginity testing has no scientific value and can cause harm. At Fluentoons English, we believe simple language can help people understand difficult subjects respectfully. Medical facts do not remove personal, cultural, or religious values. They help people make fairer and safer decisions. Choose facts over rumors. Choose calm communication over suspicion. Choose dignity over humiliation. A person's body should never be used for public judgment. Thank you for watching. Share this message respectfully. Always remember, the appearance of a hymen cannot tell the story of a person's life, character, or worth.